It's estimated 24,000 people will lose their sight and become legally blind from the effects of diabetes. In the U.S., there are 16 million diabetics, and 1 in 4 of them have some form of diabetic eye disease. Here to discuss diabetes and how it affects our eyes is our friend Dr. Brent Reed from Griffin and Reed Eyecare. Dr. Reed, welcome.
Thank you, Walt. Good to be here.
Nice to see you back. How would I know if I'm at risk for diabetes?
Well, certain ethnic groups do have an increased predisposition to diabetes. You're just talking about African Americans and smoking. African Americans are at higher risk, as are Hispanic folks. Probably family history is your number one clue as to whether or not you're at higher risk for diabetes. But if you're overweight by as much as 15 to 20 pounds or more, your risk of diabetes goes up. There are also certain symptoms, Walt, that are fairly classic with early onset diabetes. Some of those are an excessive amount of excessive hunger, excessive thirst, increase in urinary frequency, also increase in irritability, excessive weight loss that's not planned, and blurred vision actually is one of the things that brings people to see me that helps me to diagnose early onset diabetes.
What does diabetes do to your actual eyes and vision?
It's a good question. What happens is, as far as eyes go, eyes probably are overrepresented when compared to other tissues in the body as far as the blood flow that they both have and the oxygen they take from the bloodstream. As a result, what diabetes does is it destroys the tiny fibers within the blood vessels, or the lining of the blood vessels, and the blood vessels deteriorate. Early on, what happens is the blood vessels we were born with deteriorate, begin to leak, and begin to break down. And then as the blood flow and the oxygen that should be delivered to the eye decreases further, your eye actually starts to grow its own new blood vessels, and that's the form of diabetic eye disease that can blind you.
Doctor, what about for people who have good eyesight? What can they do to keep it that way?
Well, the most important thing that a diabetic can do particularly is to get routine annual dilated eye exams. Absolutely critical that they do that. If they're getting dilated every year and having their eye checked carefully by an ophthalmologist, the odds are that they're going to stay in good shape. 90% of people in a recent study were shown to maintain excellent vision and not have diabetic eye loss, vision loss, if they did those things.
Doctor, for the people who do have diabetic eye problems, besides losing weight, what else can they do to help change that?
Well, if you maintain a good diet and maintain tight blood sugar control, that's somewhat arguable about what those numbers are. Most maintain that below 130, above 70 is tight control on the numbers for fasting blood sugar. But eat a good diet and make sure that the diet's well balanced. Make sure the blood sugar's in tight control. Check your blood sugar several times a day if you're diabetic with a glucometer. Make sure that you're doing all that you can to maintain a tight range.
Thank you for stopping by. Always good to see you. Good tips.
Thanks, Walt.